Assalamu alaikum rahmatullahi wa barakatuh. You are listening to the Mid Morning Talk on Salam Media. Wednesdays is our health segment, and today we are discussing asthma. Asthma is a major non-communicable disease affecting both children and adults, and is the most chronic disease amongst children. Asthma affected an estimated 262 million people in 2019 and caused 455,000 deaths. Avoiding asthma triggers can help you to reduce asthma symptoms, and here's what you need to know. Dr. Evie Rapiti joins me to tell us more. Good morning, Dr. Rapiti, and thank you for joining me.
Hi, good morning to you, Maryam, and good morning to your listeners, and thank you for having me on.
Doctor, please start off by expanding on what asthma is and what causes it.
Right. Asthma simply means it's got the three components to it, and that is, if you can imagine your airways like a tree, the upside down branch, it deals mainly with those airways. It's really an allergic component. So what happens? You get three components. You get inflammation of those airways. In other words, the lining of those airways gets inflamed. And then what they do is they produce mucus. And in that mucus, there are cells that are released that causes the muscles around those airways to tighten up. So you get mucus, you get swelling of the lining, and you got narrowing of the vessels. These three components put together, they cause narrowing and a tightness. And it is usually accompanied by a wheeze when it is severe. But that is not entirely true, because as one gets older, the tightening is not narrow enough to produce a wheeze. But what you then feel is a shortness of breath on slight effort, or you find difficulty with breathing, or the main symptom is cough because of the inflammation and the mucus. And many people don't realize that the coughing is probably, I would think, the most common symptom of asthma. And if you don't treat that cough with the proper asthma medication, you'll end up drinking bottles of cough medicines that are quite useless, or you'll run to a whole lot of antibiotics, also useless. And cough is a serious problem. If you had to ask me, for over 30 years I'm doing asthma, I have a special interest in it. I rarely see people with severe asthma presenting with a wheeze. In fact, today I must have seen 3 or 4 patients who came to me with a cough, not knowing they actually had asthma. Now, the measurement we use by which to decide whether one's got asthma or which helps us is a peak flow meter. It's such an easy test. I wish more doctors would use it, because when you blow into this peak flow meter, it's a simple, particularly not on time stream. I would demonstrate it to patients or your viewers what a peak flow meter looks like. When you blow into it, an average adult would blow in the region of about 400 milliliters per second. Now, with asthma, you could blow as little as 100 and wouldn't be aware that your chest is tight. And this is the problem. Most people think, oh, if my chest is tight, then I've got asthma. It's not tight. I don't have asthma. But you've got limitation of your physical activity. I want to quickly run through the factors that trigger off asthma symptoms. This is cold air, change in temperature, suddenly from cold to hot or hot to cold, misty weather, then the dust count and pollen season, and these can affect it. Then perfume sprays. There are things like even emotional asthma, where one laughs too much, you can trigger off an asthma attack.
Wow.
With presence of noxious fumes like smoke, paint, perfume, spices, any one of these things can trigger off asthma symptoms. And invariably, a lot of people who have asthma also have hay fever and rhinitis. And another very important trigger factor that a lot of people don't know, not many doctors even are aware of it, when you get a viral infection of the chest, like you get a COVID infection, very often the virus itself acts as a trigger factor. And that can trigger off asthma symptoms. And I've seen this happen in my practice. People who had COVID suddenly coming back with a week saying, oh, my COVID's not gone, I can't breathe, I'm short of breath. And when you check them out, they've got no symptoms of COVID, but they've got a tight chest. And you don't treat this asthma because it brings on the asthma. It doesn't mean it causes asthma. A lot of people have asthma, but they don't have trigger factors to bring it on. So you treat them for it. And what happens is that your course of asthma could last for as much as 6 weeks if you don't treat it early enough, or for the entire winter season. And if it's not diagnosed as asthma, you'll be diagnosed all the time incorrectly as bronchitis, getting antibiotics, which are really useless. Because too much of antibiotics is not good, because you could get antibiotic resistance and you run into problems. If your mucus is not of color and all you got is white clear mucus, what you would need is a proper pump. Having said that, I need to just mention that a lot of people run away with this idea that the pumps are weakening the heart, which is absolute nonsense. It's housewives say you don't get addicted to the pump. And there are two types of pumps. One is called the reliever. That's your Ventis, your Ventolin, your Barotec, and Astavent. That's your reliever. It releases a smooth muscle, opens up the chest. But today, the main theme of your main way of treating asthma is prevention. And we use a steroid pump. And the steroid pump is a very low dose. And that's the pump we should be using. Many people rely on the Astavent pump, and that's a big mistake, because you're not treating the underlying trigger factor, the inflammation. That's what we need to treat. Not so much if you treat the inflammation, you wouldn't get the spasm. And the pumps that we recommend to use is any one of them, Butaflam, Pulmicort. Now we've got good pumps, like we've got combination pumps like Symbicort is one of them, Theraflow is one of them. These have a combination of a steroid and a long-acting bronchodilator. What we mean by that, it's like an Astavent, but it works on a longer-term basis. So if you use a two-in-one pump, you don't really need your asthma pump. And if you are an asthmatic or you've got asthma over the winter period, I would certainly recommend one to use it during this entire winter period. Use one puff in the morning and one puff in the evening. And a lot of people don't realize this, that the most common time to have a cough is in the early hours of the morning. It's called morning dippers, because around about 3, 4 in the morning, the temperature can drop right down to as little as, say, 4 to 5 degrees. And if you have hay fever, which many of them do, and they don't treat, you breathe with your mouth, and that cold air that goes in acts as a trigger factor. Now, remember, when you breathe with your mouth, which 80% of the world's people do, it is bad because it leads to snoring. It leads to sleep deprivation because you do not have good, regular, easy sleep. Besides that, remember, when you breathe with your nose, what happens is the nose has one major function, and that is to warm the air. If the temperature of the air outside is -2, by the time it traverses the nasal passages, it rises up to 38 degrees. It also traps the air, traps the viruses, so it's got 3 functions. Whereas if you breathe with your mouth, your dust, which is a trigger factor, goes into your airways. Then you've got your viruses, which causes infection, and the cold air acts as a serious trigger factor. Now, many children are not using their pumps correctly because mommy says, no, don't get used to it. And what happens? These children cough in the middle of the night. These children can't get up because they sleep deprived. They've been coughing all through the night and not having a decent night's sleep. In the morning, at about 10 o'clock, they have daytime drowsiness, because what happens is, because they have not had a good night's rest, they cannot focus and concentrate. And I certainly think there haven't been studies, but if you think about it logically, if you are sleepy at 10 o'clock, you're not focusing in class, you cannot concentrate, your grades are going to drop. So and a lot of this is missed. And I've come across people who've had daytime drowsiness as drivers. They would tell me, I've had 2 patients say, doctor, I don't know why I sleep the whole night, but I'm falling in my truck and I might lose my job. And they never mention anything about asthma and hay fever. And because I'm very suspicious, doctors must have a high index of suspicion when you have these kind of conditions. Why is somebody that's sleeping well and still feeling tired in the morning? It's because they have disturbed sleep in the course. I put them on a nasal spray, which is very important. When you treat asthma, very often all they do is treat the lungs. Asthma starts from the nose. Got to clear the nasal passages. And there too, we use the steroid nasal spray. We don't use these nasal decongestants like Corenza C and Sinumen and Sinuped and God knows what. These are all ephedrines. They are actually not good. They are addicting. They dry your nose. Whereas if you use a steroid nasal pump and you use it properly, it will stop mucus deposition. And a very good thing, simple, in your kitchen, is salt water. Wash the nose, wash the throat, clear the mucus. It's quite simple. And then you use a nasal spray. You breathe better and use your pumps regularly, and you're good to go. The other point I need to mention is that we don't treat asthma adequately. You find a lot of these children end up becoming obese because they cannot participate in sport. Why? Because when they run, they breathe with their mouth, they breathe the cold air, causes them to get tired, and they start thinking, oh, I'm fit. Those of your viewers or listeners listening in today will identify when they go to a gym and they've got asthma, they would notice the more they exercise, especially in winter, the more tired they get and they think, well, they're unfit. If you're unfit, you should be improving. But with asthmatics, what happens is when you run, your airways pulls closed. It's called exercise-induced asthma. I know some specialists don't agree with it, but I do because it's not the exercise inducing it. It's when you exercise, you're breathing cold air. The cold air then triggers off an asthma symptom and you get short of breath. But yet, if they use their pump half an hour before they go and exercise, they'll be able to function. Why is this important? This COVID and the stupid lockdown policy has made many of our children that were thin become fat and fat become obese because they weren't exercising. So we need to get our children playing out there and exercise. We got asthma. The modus of treatment or the way we treat asthma is to make a person who's got asthma to feel as normal as anybody without asthma. And just to give you one example, in 1968, Mark Spitz, Olympic gold medalist, he was an asthmatic, and he won 8 gold medals. What I'm saying to you, asthma should not be treated as a disease like that you're an invalid and you're a chronic condition and you can't do this and do that. You use your pumps correctly, you use them regularly, and you should be good to go. You can play sport, you must get involved in activities. So I think it's quite a distressing condition, and the mistake that many people make, and particularly mummies, they would say, no, don't use your pump so often. Wait till your chest is very tight. It's too late. The earlier you get, that is why it's called prevention. When you know the weather is changing or it's bad, use your pump rather than to wait when it's tight. When it's tight, very often the pump cannot go to the airways. So with the result, it's not effective, then we need steroids. You know, Maryam, in my 3 years, I don't think I've had one admission into a hospital because of my acute management and my hands-on approach and the education I give my patients. Once they understand it, they don't end up running to doctors and drinking bottles and bottles of useless poisonous cough medicines and take these Sudafed and all these known drying agents and God knows what. So,
right, doctor, quickly, the time is not on our side, but quickly, how often should you change your asthma pump?
Well, you got to use it regularly. When you never run out of it. I always say have a spare one. You never run out of it because you don't know when somebody will come with some perfume and next thing trigger off asthma symptoms. And remember, the pump is so safe. I use it on 2-month-old children. So this thing about it's unsafe is a lot of rubbish. Because one spray of pump has only got, 100 micrograms of steroid. 1 teaspoon of Ventis, by the way. The syrup is 2,500 micrograms. People love syrups. They're useless. Use the pump. It's safe. Yeah, there's a lot to be said. I'm afraid a lot of the experts in teaching hospitals don't know much about mild asthma. They think they're the cat's whiskers. They don't treat mild asthma. They treat severe ones. I believe you don't treat asthma in its early stages. You'll end up with severe. Severe asthma is a failure of treatment asthma in its early stages and proper education of asthma. I rarely have problems with them because they are well informed, well educated. They know how to treat it, and they don't buy the myth. The pump weakens the heart. It is asthma that is untreated that weakens the heart and affects all your physical activity.
Wow, so much information that we still didn't know and need to know about asthma, because I mean we hear all of these stories and we follow the stories and just get the basic treatment from the doctor. But now that you mentioned everything that you did, it gives a whole new perspective on asthma and dealing with it. Dr. Rapiti, it has been a pleasure chatting to you, and thank you so much for your time.
Okay, thank you very much, Salama. Maryam, have a good day and all the best to your listeners.
Likewise,
Yes,
goodbye.
bye.
That was Dr. E.V. Rapiti taking us through the symptoms of asthma, what it is, and the alternative methods to treating asthma. So much that we still need to know about asthma, about this non communicable disease affecting both children and adult. And like doctor said, don't wait until it's too late. Go for checkups if you feel like you might have asthma. And obviously, the best way to start is with your GP, and your GP can send you to a specialist. All right, it is 5 minutes past 12. You are listening to the Mid Morning Talk on Salam Media. Please stay with us. Up next, we have the hit list.